Good evening. I'm Dr. Portia Mosadi, and I'm an obstetrician, gynecologist, and aesthetic gynecologist. Today, we are talking about pregnancy in the era of COVID-19. This is a disease that has affected the whole world, and we are battling with treating the condition. We still don't have a vaccine, but the healthcare workers are working on it. And it's a disease that is transmitted it's airborne, and it's a disease that can be found in other surfaces as well, as we have been informed by the people that are dealing with the disease. It is very important that we take care of ourselves, we wear our masks, we make sure that we wash our hands, we use hand sanitizer, and we take precautions. We distance ourselves from each other, but at the same time, we also need to be able to interact as people. But the problem is now you are pregnant, you are carrying your baby, and you become diagnosed with COVID-19. What then? It becomes a problem, it becomes stressful, you become anxious as a mother because now you are carrying this baby, you don't know whether you will transmit the disease to your baby, whether you should go and seek help because you're worried, if I go and then I'm going to infect my doctor and other people that you're going to see in the practice. So it becomes a very stressful situation for you as a pregnant woman. You still have to attend your antenatal visits, but then do you go with your partner or do you stay by yourself? Do you go by yourself? So it becomes a very lonely disease. So today we're going to really try and give you that support, give you that information that you need because you are in a stressful situation. Or your partner gets tested and your partner tests positive, and now you have to be the one taking care of your partner, and at the same time you are pregnant. But there are steps that one can do. For example, you need to attend your antenatal visits. If you are tested positive, you can still communicate with your doctor via telemedicine or using video call or calling your doctor. And depending on how far pregnant you are, it is extremely important that you keep that contact with your doctor, whether it's a gynecologist, whether it's a GP, or if you are attending with a midwife. But then you would also need to be escalated to seeing your doctor. You need to have a balanced diet. You need to eat well, and you need to make sure that you are well hydrated. Take warm fluids and make sure that you take supplements. You take immune boosters. You make sure that you are well. You take care of yourself. You do a few exercises. You walk around the house in isolation. If you are in your room, you walk around in your room and you make sure that you are not in contact with the people that are taking care of you. Yes, it's a disease where you have the condition and you're supposed to be alone and isolated from other people, but at the same time, you are going to need that support. So what are the strategies? What are the tricks that one can use when you find yourself tested and you are positive for COVID? If you don't have symptoms, you stay in your room. And ideally, you use your own bathroom. You ideally use your own dishes and you use your own cutlery. Wash your hands, wash your cutlery, wash your dishes so that you do not infect other people because the virus can stick to the surfaces of the equipment that you are using. And then you also need a bit of sunlight so you can sit outside. Your family distant from you and they can have a conversation with you from a distance so that you're not fully lonely and going into depression. You can video call with other people so that you keep that contact and you keep in touch. If your partner also gets tested positive, it's extremely important that you both isolate because you don't want to infect the rest of the family. So it's very important that you isolate. It is a difficult time, but if you now become symptomatic, you need to consult your doctor. And your doctor will advise you on whether you need to be hospitalized or you don't need to be hospitalized. But if you feel that your symptoms are getting worse, you really need to be hospitalized because that's where you're going to get more medication for the disease that you have. For example, there is blood thinning medication that you might need, and it will assist with relieving your symptoms. You will need your immune boosters. You will need your supplements. You still need to continue with your pregnancy supplements because we still need to take care of the baby that is growing inside you. So you need to be able to be admitted at some point, and you need to go to the hospital. A lot of people are scared to go to the hospital because they are scared that if they go to the hospital, they will get worse. But that is where you will get help. The hospitals are equipped and they are ready to receive and to treat the patients that come with COVID-19. So COVID-19 can have mental effects. You can have anxiety, you can have stress, you can have depression, because it is a disease of loneliness. So COVID-19 is a stressful disease. It is stressful because we have seen the numbers of deaths going up, and we have seen the number of infections going up. But luckily, the number of infections are now going down. And it is extremely important to get the support that you need. And for you to get your mental state right, you know that you have support. You know that your doctor is there. You know there is counseling out there. It doesn't have to be physical. It can still be via your phone. So there is help out there. So there are methods of reducing the stress levels that you are facing because you have the COVID disease. It's extremely important for you to keep in touch with your doctor. You don't have to be ill alone. You don't have to be ill in isolation. Yes, you are isolated because you're protecting the ones that you love. You're protecting the country. You're protecting the people that are around you. But at the same time, keep in touch with your doctor, because your doctor is there to assist you, to give you the support that you need. If you have questions, your doctor will be able to answer those questions. And if you feel that your symptoms are not getting better, your doctor will be able to assist you in advising you where to go and when to go to the hospital. And it can be a very depressive disease, but we have people that deal with mental situations, or people that deal with depression. We have psychiatrists, we have psychologists who will take care of you. And there is no shame in expressing how stressful you are. There is no shame in expressing that you're anxious, because yes, you're a mom. You're carrying your baby, and this baby you're going to bring this baby to the world, and you don't know what is happening. You might be hospitalized for long, and your family is not able to come and visit you. And that will give you anxiety. But just really try and relax and really have faith in the health system, because the doctors and the nurses are there, and the other support structures within the hospital are there to assist you with your condition. We must also not make having COVID-19 a stigma, because that's what's going to increase with the numbers. If you have COVID-19, it's a disease that we know that we're all battling with, So it's very important that you keep track of the people that you have been in contact with, so that those people can be contacted because they have been in contact with somebody who has COVID-19. So it's very important that we're not scared to mention that we have COVID-19, so that we will be able to track the people that we have been in contact with, and they will be able to track the other people that they have been in contact with. In that way, we will be able to contain the disease and not make it spread even more. And as a pregnant mother, it is extremely important that you discuss your delivery plan. Depending on how far pregnant you are, you and your doctor need to discuss how you are going to deliver the baby. So say, for example, you are almost at delivery time, and here you are, you have the disease, and now you don't know what to do. Please speak to your doctor so that they can advise you as to what is going to happen. Sometimes you're still early on in the disease, and you're still early on in your pregnancy. At least you will be able to have time, so that you recover, and you will be able to deliver your baby when you have now recovered from the disease. But if it is time for you to deliver the baby and you are in labor, have the faith and have the trust that the doctors are ready, and the nurses and the hospitals are ready, and they are able to treat and treat you and help you with your delivery. If it's early in your pregnancy, they will give you the treatment and you will still be able to carry your baby. But sometimes there can be complications with the medication that you get. For example, some women bleed because we give them blood thinners. Don't panic, call your doctor, go to the hospital, and you will get treated for the symptoms that you are having. So the delivery plan is important for you to discuss with your doctor. Don't stay away from talking to your doctor or your healthcare taker because you won't know. Because some patients really stay away because they are scared that they will scare the doctor, they will scare the healthcare taker. But it is extremely important that you keep in touch, because that is what is going to save you and that is what is going to save your baby. A lot of mothers ask, if I have COVID, will my baby get COVID? The answer is, there is no clear evidence of whether the COVID can be transmitted to the baby or not. And because it's a new disease, there isn't much in terms of information as to whether you will find that your baby will get COVID through the baby being in your womb or after you deliver your baby. There have been cases where babies or neonates have had COVID, but it's not clear whether they got the COVID from when they were inside the womb or after delivery. So those are the things that pregnant women deal with, but it's extremely important for you to really calm down and really don't add too much stress. Sometimes you might need to be delivered in time because you're very sick. You might be delivered in time so that you can be intubated in ICU. Sometimes you will be in ICU for long, and you just need to cooperate with the system. Your family just needs to be there and supportive in your condition. Unfortunately, they won't be able to come and see you in the hospital, or they might not even be there for the delivery of your baby. But for you to have the understanding, and for your family to have the understanding, that will help a lot, especially with the family if you are in ICU. And the other thing is that now that we are in lockdown, in level 2 lockdown, now the hospitals have opened for the partners to come and visit, or some hospitals have opened for the partners to come for the visits, because it's really nice, when you have your partner coming to your antenatal care visits. Now we're talking about patients that are coming for their regular antenatal visits when they don't have COVID or when we don't know their COVID status. So it is nice now that we can have partners coming in, visiting and seeing their babies scanned together with their partners. It is very nice. So now COVID, it's very important that you know the COVID helpline in case you need assistance or you need more information about COVID. And you always need, I think, just put that number on your speed dial, 0800 029 999. Always have that number, because that number you can phone and ask for information if you need more information. And it's very important that we still, even though we are on level 2 lockdown, it's important that we still maintain social distancing. We stay at home, we stay safe, we still wash our hands, we still use the sanitizer, and we still wear our masks every day. And I just want to say thank you to all the healthcare workers that have been in the forefront. Sometimes it's really scary to be fighting this disease. When you go home, when you go to work, and when you come home after work, the first thing you don't want to do is to greet your children with a hug, because you want to go in and change your clothes first before you can even greet your children. But we do it with love, because this is our job, this is our calling, this is what we do. And I also want to say thank you to the people that have really listened and adhered to the lockdown rules. People who have stayed home, people who are using their sanitizers and really adhering to the rules that the government has put forward. And I also want to say my deepest condolences to the people who have succumbed and lost their lives to the COVID-19 disease. And on that note, I also want to say that I hope this has been a good Women's Month, and I hope changing the narrative has been informative for you. And this is something that is very, very important. Our health is very important. And for us as women, it is very important for us to continue changing the narrative, for us to continue talking about the diseases or the conditions or the problems that affect us as women. And I just want to say thank you for the support that you have given me over this Women's Month. And let's keep the spirit of women empowerment going. And I just want to say thank you very much to the support that you have given me. And thank you so much. Let's continue talking about the women's health issues.